Sure that this is awesome. Well, hi everyone. I am Maya from Amira, and I'm excited to kick off the hot topic. So, hot topic is a series of events, virtual events, where we bring experts to discuss the most swept under the rug topics. We'd love to kind of get started with introductions. So, the experts that we have on board today are Dr. LaReesa and Colette. So, I'll pass it on to both of you to introduce yourself.
Great, thanks, Maya. Well, very excited to be here. I'm Dr. LaReesa Ferdinand. I am a OBGYN and the CEO and founder of Thrive Beyond Wellness, which is an integrative medical wellness center here in Orlando, Florida. I do specialize in the niche of taking care of, I like to say partnering with perimenopause and menopausal women. So this is right on time. This is a juicy topic. We are here not to make it taboo, but something that you even are armed with the things that you want to do actionably to take forward from this conversation. So thanks to Amira and the team for bringing this together. And it is indeed a hot topic.
Yes, and I'm Colette Courtion, and I'm the founder of Joylux. And Joylux is a women's health company focused on delivering non-hormonal based products to women who are going through perimenopause and menopause. The core of what we do is around red light therapy, and I will be certainly talking about that in more detail later. But I am just super passionate about helping women. This is a time in a woman's life where she should be thriving, and sexual health and intimate health, that all plays a big part of thriving during this very important transition. So I'm here to talk about what we do, what we see, and just support women any way we can.
Awesome. Well, so great to hear about your introduction. I kind of want to zoom out, and for anyone who has never heard of any symptoms related to vaginal health or sexual health, or have no idea about what happens, I have a question for you, Dr. Lisa, about what are the primary physiological changes that occur in vaginal health during menopause, leading to issues like dryness, and how long do these symptoms usually last?
Yes, and I like how we're starting at the basics. And not only am I an integrative health practitioner, but I like to speak in terms of practicality, because a lot of times women may not be armed with not only what it looks like, but how to describe it with their physician. And I'm sure many of you probably have recently seen the misdiagnosis of Hailey Berry and herpes that's been on the market right now. And that's mainly because of many things that may happen in the experience with a clinician. So starting at the basics is the vaginal area is made of layers of cells, and those layers of cells make up a tissue and a matrix of a tissue that is very well responsive to estrogen, which is the power hormone, or what I like to call the boss hormone for women throughout their reproductive years. However, it does significantly drop in menopause. And just to make sure we're all on the same page, menopause is the absence of a menstrual cycle for about a year, or if someone has had a surgical menopause or removal of their ovaries. And I like to say that because there's oftentimes mistakes of, if I had a uterus removed, that would put you in menopause. So regardless, these cells are responsive to estrogen and many of the other things that environmentally we're exposed to. And what becomes a very robust layer of cells and matrix of tissue that work harmoniously together in our reproductive years can significantly reduce in its vibrancy in menopause. So therefore, it can increase in what we call atrophy or dryness or pain in the area, or just the loss of lubrication just due to other physiologic and natural aging type areas. And oftentimes that could be very problematic for women, especially if they don't unsure of what's going on with their bodies, unsure how to really communicate what's going on, because it can be a variation of pain, dryness, or even urinary symptoms.
Thank you. And I'm curious to hear, are there any early signs of these symptoms when it comes to vaginal health?
I think so. I think the biggest thing is women to become more aware. If many women, and oftentimes I can speak of N of one, but I can relate to a lot where we're doing so much and we notice, but it could be a variation from I'm moving in my seat a little bit too much or have a little irritation or itchiness to, oh, I must have been a little dry because I didn't drink enough water today during sex, or pain or discomfort, maybe not all the time during sexual intercourse. But it could be something that are little tell signs or triggers that can happen as early as our early 40s or late 30s. Sometimes even triggered by medications that we're on. And so many of those things have to do with a heightened awareness that our body is changing, because technically it may not be, okay, I'm in menopause and have an absence of a cycle or haven't had a surgery to remove the ovaries. It could be like these telltale signs there's a transition. And that's why actually I love the term transition during this period, because it's largely more of that going on with our bodies and having that heightened awareness of the trends and the changes versus just sticking to a diagnosis.
Thank you.
Mhm.
And for Colette, so given that this is a very like taboo, and I'm sure that when you started to work on this, it was still very taboo. It is still today. So I'm curious to hear from you, what actually inspired you to focus on addressing this specific menopausal intimate health concerns with Joylux?
Yeah, thank you. I love this question because it came from my own personal experience. So the N of one right here. When I had my child, my son, I learned firsthand what women go through with vaginal deliveries, and there's a lot of trauma that occurs to the pelvic floor area, the vulva, the perineum, all that. But then shortly after I gave birth, I started to experience menopausal symptoms. And I went quickly, because I was what they call a geriatric mother. So I quickly went from giving birth to going into menopause. And so I learned firsthand what these issues were. So the incontinence, the dryness, the pain, all of that. And my experience prior to starting Joylux was in the field of medical aesthetics. So I was working with what we call energy-based technologies. So lasers, light, ultrasound, radio frequency, all these different technologies that are used to tone and tighten the skin for skin rejuvenation, for anti-aging purposes. And so as I'm going through this transition of perimenopause and experiencing these vaginal health issues, I said, whoa, aha, why aren't we using these same technologies that we're using for to restore the health of our facial tissue, but apply it to the vaginal tissue? So I had the idea, didn't even know if it was possible, but I teamed up with a very smart technologist who really understands energy-based technologies, and then an OBGYN. And the three of us came up with what is now our very popular vFit device, but it's using red light therapy to help rejuvenate the tissues, to help increase blood flow, to rebuild collagen and elastin. And these are the things that we lose as we're going through this transition phase. So for me, it came from my own, as we said, N of one, my personal experience, but I was inspired and saw an opportunity to take what my 20 years of work life, experience, and apply it to a new field in women's health. And I'm, thrilled today that we're able to offer solutions that help women outside of just what has traditionally been done. And so we're giving women a set of tools to assist in whether it's incontinence, vaginal dryness, pain with sex. We offer things that are an alternative to what has traditionally been offered.
Thank you. It's really fascinating to hear about like how are the other like non-hormonal options, and it falls under the technology innovations. I'm curious, at what point of a woman's like experience of like vaginal dryness, for example, would she want to use, or would it be best for her to use a device? Is it like early on where it's like the first thing that she will try, or would it be like kind of the last resort? She's tried everything, she's fed up, and this is now where that's her last resort to use. Like at what point of that journey? Yeah.
So actually, when we developed vFit, which again is, for those of you that don't know, is a red light therapy device that you insert, I have one here, you insert vaginally, and it's the red light that when is exposed to the vaginal tissue, there you go, it helps stimulate the mitochondria in our cells, which release key chemicals that help produce collagen, elastin, and increase blood flow, which are very important for tissue health. So, but when we started the company, as I mentioned, I had just given birth before I started going into perimenopause. And so I was like, there is a whole set of women who have had childbirth that could benefit from this technology. And then as we, as I was transitioning, I was like, but there's also women in going through perimenopause that can benefit from the technology. So the first thing we did was perform a clinical trial, and we used women of all ages. So I think the youngest in our trial was 26 and the oldest was 65. And across the board, women benefited because you can experience vaginal dryness and not be in menopause. And it certainly, I'm sure the doctor can explain more about why, but if you're taking birth control pills, that can lead to vaginal dryness. And so you can benefit from our technology regardless of your age. However, when we went to market, it was very clear to us who our customer was, because we have all this data on our customer and we know who's buying. And it was obvious that the woman buying it was the woman who was going through menopause, whether she was in her 40s or whether she was in her 50s. She was buying it because vaginal dryness, incontinence, all those issues were really impacting her more than a woman in her 20s. So we decided as a company to really hone in on that consumer by providing her with support, not just around the vaginal health, but broadly around menopause. You asked a question earlier, and I didn't really dive into it, but it's about taboo. And yes, this is a taboo topic. And what one of our missions when we started was, let's break down this taboo. Let's make it comfortable for women to discuss these issues, whether with their doctor, because still women are afraid to talk to their doctor about these things, or their girlfriends, or their partner, or their sisters, mothers. We really wanted to create an environment that made it okay for people to talk about this. So as we, now we've been doing this for over 5 years, we've really created a community where we're saying, hey, it's okay. You're not alone. Let's break this down. We are women. Let's embrace these changes. It's nothing to be embarrassed by. In fact, I'll just, not to go on a tangent, but I remember, and I don't know if you may be too young, but erectile dysfunction we started hearing about it in television ads in the 90s. And Bob Dole, who was a presidential candidate at one point, he's doing ads for erectile dysfunction. And I'm like, here we are in 2024, and women are afraid to talk about dryness, yet men have been talking about limp penises for decades. So, I think our goal is not only just to provide amazing tools to help women, but to really break down this taboo and just be like, hey, ladies, let's talk about it. It's normal.
Wow, this is so true. You actually made a really good point that now I have a question for it. And I want to hear from both of you, from like the doctor point of view, the physician point of view, and the consumer point of view. What are efforts that you have done to ensure that we're breaking down those taboos? Like, what are actually like actionable steps that you have taken from both sides? We'll start with Colette, if you want to continue.
Okay, well, the first thing is having these conversations. We love doing these live events, whether it's on Facebook or podcast. We love just talking about it because the more women hear about it, the more they're less likely to be afraid of it and squirmish about it. So we're trying to just break that down and make it everyday conversation. We've really we've partnered with physicians. We think that's really important. Physicians at the end of the day are the first person women should go to. So we are very supportive of that. So we have partnered with over 1,000 physicians around the United States to really help them with tools because we understand consumers and how to market to consumers. We like to partner with physicians, provide them with tools to help them communicate with their patients, break down this, taboo. Around advertising too. I mean, we are out there, we're advertising. We've had to fight many battles when it comes to advertising. The Meta platform, which is Facebook, Instagram, they up until recently wouldn't even let you say the word menopause. So we had to fight that battle. But, here we are in 2024, and we're starting to see really big name celebrities like Halle Berry. In fact, you brought it up at the very first thing, where she openly talked about something that was so incredibly personal. So that's what it's going to take. It's a village, right? It's not just Joylux and Colette. It's the doctors, it's the entrepreneurs, it's the celebrities, it's the influencers, it's all these people coming together saying, let's just be okay with this. It's not embarrassing, and let's talk about it. One last thing I'll say is we really encourage women to be open with these issues with their partner. So we've done a lot of where we do tools, whether it's Q&A or we even did a story once from a man's point of view, like how you should talk to your partner from the guy's, how does he want to hear about it? So just, giving women the tools, that talking about it, engaging with all these different stakeholders, that's what it's going to take.
Yeah, and I would definitely like to piggyback on what I'm hearing is a collective. It is a collective. So when we're talking about making it not taboo and what are we doing as advocates? So that's having more of the conversations, because at the end of the day, the more you have the conversations, the more you're going to tap into, let's be realistic, different algorithms, different cultures, different people, where it's not commonplace to have those discussions. So the purpose of that, I feel, is to make it one day more normalized. Unfortunately, it has been throughout the tapestry of medicine when it comes to more, this lopsided gender bias way of how we've addressed healthcare. And that's the truth, even if we're talking about the inequalities, and that's a whole nother conversation. And part of that could be part of the communication. So I definitely want to, literally check mark on everything Colette said, because honestly, it is a collective beyond just being a physician. And I learned from my own story that honestly, me being vulnerable with my patients, being relatable and vulnerable with, hey, this is something that I've seen, could be at a spectrum of what I've experienced, but actually listening and taking that next step and having tools. I cannot express even more as an integrative advocate and a physician. I'm an OBGYN by trade, but I am a advocate physician, every day about not only educating, but having more tools in my toolbox. That's why I love the FEM technology space. I love the fact that I can offer a patient and they can make an informed decision. So that's the second part. It's a medical decision model where there's a patient and values-based component. So that's what I'm a proponent of. And because there's so much out there. As a physician, I know that patients are spending more time online than they oftentimes are with their clinicians. So my verbiage ends up being, okay, how can you be the CEO of your health? How can you step into that office, not only with courage, confidence, but I know exactly what I want to talk about. And not only am I not shamed about it, but I have questions. And I have a 9-year-old and a 1-year-old. And I love to talk about, sometimes it's just the basics. And I call it my 5 W's and an H. So if that's the case, how can someone describe what's going on? Okay, what's going on? You know, what are you experiencing? Is it sharpness? Is it dull? When does it happen? Is it only with sex, or is it, with urination? Is it who, with yourself or with someone else? These are kind of, I love to bring it back to sometimes the big picture, because oftentimes people feel inundated with information, more embarrassed about it, and then really don't know where to start. And then why? Is there something Colette had mentioned, that psychosocial component, that trauma that could have happened in childbirth or with a partner, or something very seated in something else, is something that you want to touch on, because that can make a difference of how you experience this pain, how this impacts your life, how you show up in the world each day because you're uncomfortable about something or you're confident about something. So I've learned that I have to take a step back as a physician and know that I'm a knowledgeable expert, but put myself in the terms of a patient, because I have girlfriends who are very much educated, and they'll tell me first, I hate it when y'all say relax. Don't tell me that, you know? And oftentimes just taking that mask off of really being in the place of a woman coming in, it took a lot for her to get to the point of asking the question. It wasn't just overnight, oh, okay, I'm just going, there are women out there, then most of them are just, oh, I'll deal with it when I deal with it, or when I, get around to it. And so really breaking down these barriers through conversations, through understanding that it's a shared decision model, a values-based decision model that modern medical healthcare is swinging more to. And 3, understanding also about being in the place as a patient, really arming yourself with, hey, I do have the confidence and the courage to come and talk about it. And I'm very interested in what I'm going to do about it, because I don't want to suffer anymore. That's powerful when you speak in those terms. So that's what I like to do in these different venues and when I'm speaking amongst different women.
Thank you, Dr. LaReesa and Colette. This is super insightful. I'm curious, I want to kind of bring it back to like the specific symptoms and what are some potential complications or consequences of untreated vaginal dryness, for example, or other symptoms like burning, itching during menopause?
This might be unexpected, but that someone just doesn't do sex at all. So they're end up with a decreased quality of life. They've lost kind of that vitality, and it becomes this cycle of embarrassment. Because the thing is, who likes pain, right? So when you experience pain and it's uncomfortable, but that's the thing. If we're talking about a spectrum or a variation of symptoms, it could be entry, and specifically talking about regardless of what form of sexual encounter or what orientation, but it could be an entry, it could be deep thrust or sexual intercourse. It could be just wiping, from urination, or going to the bathroom more or less often, or losing urine, or feeling kind of sandpaper. I think the biggest thing is someone's experiencing it, and then they're suffering for a longer period of time where it just becomes so uncomfortable. And I feel like I want to, give you a vivid, and not to scare anyone, but I've seen patients to the point where it's been so much dryness, and also we call in the medical community atrophy, or just so embarrassed about what has happened for years, that tissue is literally has no elasticity. It's like it hardly it's like sandpaper. And to even do a pap smear or a pelvic exam, it's just like, we're not doing that, you know? So that's the extreme where the tissue just becomes so the loss of integrity and the architecture and all of the things that make it that the lack of blood flow happens. It just becomes a worst case scenario with, you know, a woman just feels like, hey, I've lost my quality of life. I don't even go there. And to me, that's the worst complication. It becomes that whole ball.
I will, and I'm speaking just in terms of feedback we get from women, and we hear from a lot of women. I'm not speaking from a place of being a physician, but one of the issues that we hear from women that is they will experience bleeding, but they will be in their past they're in menopause. They haven't had their period, and all of a sudden they're bleeding again. And they'll be like, what's wrong with me? Why am I bleeding again? And often it could be a result of that tissue has become so thin that when she's having penetrative intercourse and there's that rubbing of the penis or, you know, something on the tissue, it can cause it to chafe, it could cause it to bleed, it could cause trauma to that tissue. And so we hear that a lot. Women are like, oh my gosh, I'm 58 and I'm bleeding again. Am I not through menopause? And it's often because of the tissue experiencing trauma. And that's, again, it's that what the doctor was explaining, like sandpaper. It's really thin. It lost the elasticity. It lost that lubrication. That's one of the biggest things we hear from women where they just are so confused and scared. And so of course we're always like, first go see your doctor. That's the first thing. But often it could be just because your tissue has become so dry and thin and atrophied.
I'm glad you brought that up because outside of pain, itching, irritation, and those is bleeding is definitely up there as well. And that definitely brings about fear.
And then the other thing I will just reiterate what you were saying is, you know, the use it or lose it, that is a real thing. Because if you are not engaging in regular intercourse, your tissue does tend to become more atrophic, atrophy over time. And then it gets more and more painful. So staying with a regular whether it's with yourself or with a partner, but staying engaged in intimacy and activity for your vaginal health is very important.
That's amazing. I definitely didn't know this. I think this is very interesting to hear. If a woman doesn't do anything, what are the consequences and why it is important to actually look at it. So, Dr. LaReesa, when someone comes to you and is clearly experiencing any of these symptoms, what kind of happens? How do they find like what exactly works for them? Is it by trying different things, or it's very clear from the beginning, from their like history, from what they're sharing, that there is a very specific solution that will work for them, like either a technology, a medical device, or like supplements or creams, etc.
I always like to get a pulse of where a woman is and what they're comfortable with, because I've had patients or friends that have actually recommended even the Joylux to, because they didn't want the more expensive procedures in the office and they wanted to be able to do something in the privacy of their home. And for whatever reason, whether they had a history that estrogen or any kind of hormonal therapy could have been contraindicated, or fear still, because that does plague a lot of women as far as fear of cancer. And so having that option, but these are women also open to using a device in the vagina personally on their own, as opposed to being directive of their physician. So, or whoever their clinical health provider is. So one is getting a pulse, what are they open to? Those, depending on the severity, I call it a discovery phase. I spend a lot more time having a dialogue and a conversation because some women could be experiencing more that's a whole nother conversation too, severe prolapse, meaning that it's the tissue has gotten so lax that some of their pelvic organs have caused like a literal herniation in their vagina, where something more of, a mixture of modalities may be warranted and needed. I love using pelvic physio therapy or physical therapy as well. And I like to find people in my community who do it and are aligned with what I'm doing, because that's not available everywhere. And so that's something I want to talk about as well, because many women that may be watching this later or even present in the room today, you may not have an open-minded physician available. You may have to go online and, find the community of Joylux or other places until they have a comfort level of really what really comes next. But there's several things around the hormonal or non-hormonal. I just want to go back to say, I really like to make sure I have a lot of tools in my box, because the diversification of women out there and really doing so, it may be an attempt of trial and error, but the thing is, I have them there, and I know that it took enough for them to come forward with it. So really breaking down that barrier in that first visit is, to me, pivotal, because now they understand, like, hey, one is not, they're not the only one, but also understanding, like, hey, there's other options. And there's different ways that we can, go arounds, but it may be trial and error. And I'll tell them, the first thing may not work, or we may have to try a couple of things together. But this is a journey. But it's a journey where we'll have definitely some quick wins, but we'll definitely follow through what works best for you. So really getting the pulse of the patient. And I like to call it my discovery phase, like asking that question, breaking the barriers down, making sure we optimize that time and help them be able to make more informed decisions going forward.
Thank you.
Mhm.
You mentioned earlier that if they don't drink enough water and they go into having intercourse, does that affect their like kind of symptom? And if so, what are other like external factors that can affect um, implicitly or indirectly these symptoms?
I think this is a good opportunity to talk about other considerations, because I know there is a focus for a niche audience of perimenopause, menopause in this space right now. But I want to extend something that myself and Colette have mentioned before when it comes to, this could start from the time after birth, or, depending on the age of the woman. It could have been a traumatic birth, whether it was episiotomy or stitches or things being used, but that goes into a history, because there are other things that could be going on. It could be scar tissue. There's a certain thing that can happen where it's called vaginismus, where you have tightening of the muscles of the vagina, infections. And there's a lot of research and, well, I will say budding interest in research, because the funds are starting to come in these areas, about the vaginal microbiome. The vagina should have a certain pH in it. So even if you're going through the transitional hormonal changes, there could be definitely environmental things that have to do with someone that could have an autoimmune disorder or have a disrupted gut, or even with, all the bath, and maybe I shouldn't name names, but all the perfumed soaps and et cetera that are distorting like the pH in the back of the microbiome, where you have to have a more a holistic approach, that something else could be going on that could cause irritation, possible infection, imbalances in the pH that can worsen itching, irritation, urinary symptoms. So I think regardless, the other considerations always need to be discovered, because one particular modality could be definitely working well with building up the matrix and the tissue and the vibrancy back in to the tissue. But if you still have this recurring cycle where your vaginal pH or your microbiome down there is off, someone may not be achieving the optimal results. And I like optimal and not just, okay, it's normal. It's as long as it's getting better. So I definitely want to put that out and make sure that, other considerations need to be discussed.
Yeah, I'll actually add to that because this is an area that we love to talk about and educate women, is that your vulva tissue, your vaginal area is the tissue is very delicate. It's very absorptive. So whatever you put around it down there, it's going to absorb. And so we want to make sure that you're putting products down there that are intended for that tissue. So pH is a key word. There's a lot of products, whether it's bath products, body products, that have very high pH levels. So they're in the 9 to 10 range, but a woman's pH down there is more like 4.5. So if you put a product that has a pH of a 9 down there, it's going to throw your pH off, and that's what can lead to irritation. So it's really important that if you are using cleaning, any products that clean down there, moisture down there, that you really make sure they're intended for those tissues. Also, the ingredients themselves, avoid things that are bad, parabens, PEGs, all these nasty things that people put in skincare products or fragrance or things that could cause irritation. Don't put them down there, because that can, again, throw your whole everything off and could lead to that irritation, itching, which, no one wants. So really make sure that how you take care of your body down there is different than how you take care of your body everywhere else.
Definitely. And I call it vaginal hygiene. We use hygiene in so many ways, our facial hygiene, our hand hygiene, but there's a certain vaginal hygiene. Even a most simplistic thing that I will discuss with someone, especially who's having issues down there, is I like to, hey, pat front and back, even the rubbing or the friction movements down in the vaginal area. When you already have a primary problem or initial incident or issue, just even doing that simply, because and I'll go ahead and put this out, and you'll let me know, Colette, I'm very interested. What are some of the normal habits that women are doing that you don't know? And one of those are, a lot of women may keep baby wipes or different wipes in their car because they're wiping themselves regular times of the day, either through sweating. They've had a little dribble and they like to stay clean. It's normal. You want to stay clean. Over time, though, depending on what kind of wipes or agents that they're using, it can worsen some of their vaginal atrophy type symptoms, causing more irritation. It can cause, even vaginal infections because the pH has gotten so off. So now you have someone who hadn't had a yeast infection in years, or BV or something coming out. So even from a hygienic standpoint, taking it a step further, like, what are you using? Okay, and a lot of times I'll call out, are you using wipes or, doing stuff throughout the day? Because oftentimes women are doing things just, normally, and this is what they do, but it could also be part of the ongoing problem that they may be experiencing as well.
Interesting. There's a question that came in from Amy.
Mm-hmm.
What is your take on a bidet as far as vaginal health?
That's a good question. I get this a lot, actually. I'm actually not against a bidet. I think the whole part of it is, cleansing in that area. I think overuse oftentimes may cause a disruption in the vaginal microbiome. And especially if a woman may be on contraceptives or other particular medications that may cause more disruption if a woman is sensitive based on her biology. But I'm not against them, but I like to always say, okay, how often are you using them? if someone has a problem, well, let's see if we factor that out. Is that going to make a difference? And then also most of the time women are using different sprays, perfumes, or scented soaps along with the bidet. And like I said, sometimes it can go back to practical basics of things that people could be doing on a daily basis that is increasing their risk of some of their vaginal symptoms. So I'm not against it, but at the same time, I like to put a strategy around how often, frequency, and what else you're doing with it.
Thank you.
Mhm.
And you both mentioned about the vaginal pH balance. How does one go about measuring that?
I'll just speak in terms, oh, sorry.
No, I just to clarify, measuring your pH or measuring the pH in a product?
No, measuring like
Okay.
our pH. Yeah.
In a doctor's office, if they still keep it, some doctors don't, may or may not have it. They actually have pH strips, but there are different things out on the market now that you can do at home. So, and just to have an idea. And even then, most of the time, if you're starting to have more of a, smell or irritation, then that is a sign of a more alkalinic pH. But there's simple ways that you can just be able to do so.
But just to clarify, I don't think either of us are advocating that you need to be checking your pH. We
Sure.
know your body has naturally a pH of about 4.5 down there. So unless you're experiencing something that is different, but I don't think you need to be measuring your pH. Just know that the products that you're putting down there, and if you're buying a product that is intended for intimate areas, intimate wash, read the labels. They will tell you if they're pH. They'll say pH balance for vulva tissue or vaginal tissue. So they'll advertise it if it's a good thing. If it's not, it's probably not a good product. It has a higher pH.
But I'll go back to what you said, Colette, of the ingredients,
Yeah.
because what I have noticed that certain products out there, because of marketing and advertising, just like with anything, there's stuff out there that could say whole grains, and mostly, and then you turn on the ingredients and it's really not, a lot of enriched ingredients. And so, but that's where the knowledge comes from and really looking into it. So I always, or at least I try to lead people to understand, because it can be confusing. No one wants to sit there and read ingredients. A lot of the stuff you can't pronounce, even I can't pronounce myself or hadn't seen since organic chemistry in school. But if it starts having like one of the things to look for, if it has like a color and a number, then there's some dyes. And there may be products out there that say pH balance, but they've added other dyes and other substances to it. I do lead people, especially if they're really trying to make sure that they remove some of these areas out of their products. I'll tell them, go into the Environmental Working Group site. They have a luxury of different products out there that they've rated, so you can be more armed and at least have a better understanding instead of trying to figure it out yourself. A lot of times I may have my go-to products, but at the same time, a lot of times you can't necessarily go strictly by that. Colette, nailed it when talking about ingredients, and a lot of times they'll say dye-free, paraben-free, etc. And really doing some due diligence of what's out there. The more perfumes, most likely it's going to be more alkalinic and cause more of a higher pH, basically. So if it smells really, really good, then I would definitely check the ingredients on that.
Awesome. There's a follow-up question from Amy. So questions about Beday contributing to UTIs. Is there a correlation?
Yes, there actually has been a correlation in certain, and I can't really recall right now some of the statistics of that and where to pull that information. So I'm sorry, and I can follow up on that later. but that has been the concern of bidet use and controversy. So pretty much anything that's out there, there'll be a pro, for it, and then a con for it. But I'm gonna go back to my original response, is really understanding, okay, what's going on with the person? What are they doing for their normal hygiene from day to day? And if this is someone coming to me about UTIs, I'm going to most likely take you off of the bidet, because that could definitely be a risk factor for you, because there are some related events. Now, about a Brazilian wax, whether it makes you more prone to UTIs, so what is your stand on Brazilian waxes? There's honestly, there's some mixed opinion with this as well. I can only speak as my opinion. And my opinion has to do with 20 years experience as an OBGYN and taking care of women. If a woman wants a Brazilian wax, she's going to get a Brazilian wax. If a woman wants to do that and she's not having any issues or problems, I'm not going to tell her that she shouldn't do it if she's not having any issues or problems. Because at the end of the day, many women are going to do from aesthetic procedures and understand the risks and benefits, but it might be something that they want to do because it makes them feel good. However, if it's a particular clinical issue or medical problem, we are going to have to address that, because now it's changing their quality of life and possibly exposing them to more antibiotics, therefore antibiotic resistance. So it may be the frequency that they get the waxes, or just having a more personalized plan. When we go more into a one size fits all, we're not really personalized or strategy behind what a woman may need, versus necessarily countering to, oh, okay, well, this is what you have to do, when it's not technically something that best fit that person.
I want to add, though, since we do have the doctor in the room, it's always
Yes.
good. UTIs are definitely more common as you age and go through menopause, and that is correlated to the thinning of the tissue. And a term, and I may not say it correctly, but that's why we have the doctor, glycogen, the loss of production of glycogen in your tissue as you age. So maybe you can explain to all of us a little more why women, as they're going through menopause, have a higher degree of UTIs.
Absolutely. Actually, there's a name that we give it, or genitourinary syndrome of menopause, or GSM. So you'll see that a lot, but it does have to do with this, not only the matrix changing, we mentioned glycogen, lack of collagen, estrogen. We call areas of our body or tissue have what we call receptors. And so our hormones have a little house or a seat on these little areas of, we can't see them, but how our body responds to the environment could be driven based on environment and also what goes on our bodies naturally. And with these receptors, they change with time, just with the normal aging process and with the lack of a lot of these hormones that used to be around, with the boss one, specifically estrogen, playing a large part. So with that, going back to the layers of that area, the collagen and the tissue matrix, bringing in all those factors that really build up that tissue. Our body is a magnificent instrument. And so with this and I want to stress this too, since we're talking about within the menopause community, that this is a natural transition that should be embodied. And when we talk about these changes, it's not to veer upon something negative. It's something to be armed that this is a natural change that can happen. And when that musculature within that pelvic floor is not the same as it was in our 20s or 30s, that tissue and that musculature changes in such a way where women, we're already at higher risk of getting UTIs throughout our life just because we have a shorter urethra. So now that you change a lot of that tissue response to what's going on in menopause, it can increase the risk, therefore, also that already exists for most women of UTIs, or having urinary incontinence where that muscle around your urethra or that tissue around the urethra has lost some of its integrity. And I want to go back to risk factors. understand that a lot of times if women have had childbirth or traumatic childbirth, many women stand on their feet for longer periods of time. So there are many things that can still be risk factors throughout a woman's continuum that may increase the risk of those symptoms. And then the variation on the other hand of the spectrum, I could meet women who have had all the above and they don't have a symptom, all right, or have no problems. So understand these are variations, and it's hard to really practice complete cookie box medicine when really you have to personalize what a woman may be going through, and it's not a one size fits all, but that's, you know, part of what's going on down there during this transition.
Awesome. Well, we're almost out of time. I'd love to open this up for questions. So thanks, Amy, for kicking us off. Well, we've been talking today mostly about vaginal health. I'd love to kind of broaden the conversation and hear from everyone in this room what symptom of menopause is causing the most disruption to your life today. And you can go off mute or type in your questions. And as we're waiting for questions to come in, I have some that I have prior to the event. So, how to get in the mood despite the lack of desire. That's something that we haven't talked much about.
I'm sorry, what did you say?
The question was how to get in the mood despite lack of desire. The question that came in.
I'll address this from because we talk to women a lot about this, is first understanding your body and understanding what turns you on and what feels good, and then communicating that to your partner. I think so many of us are afraid if we say, this is what I want, this is how I like it, because you don't want to put your partner in and make them feel less of a person, or that they're not performing, or so people get afraid to communicate. But if you don't communicate and you don't share what's important to you, then the whole act of it won't be worth it. So the first thing we say is have an open dialogue with your partner about what feels good to you. And again, we provide women with tools to help them start that conversation. How do you say to someone like, I'd like you to touch me there, or I'd like you to... So that's key, starting for first communicating what you want. Second goes back to what I said earlier, use it or lose it. And if you don't keep up with it, then that affects your desire, and then it affects how it functions and everything. So you got to be committed to it. I always joke that seldom do you, after the fact, when you're in a loving relationship, seldom after the fact you say, gosh, I wish I hadn't done that. Generally, it may take a while to get into it, but once you're in, you're like, okay, that was pretty good. So I always say, just, you got to dive in. Now, a lot of women, and certainly the doctor could talk a lot about this, is the lack of desire could also stem from it being a bad experience resulting from the pain or the trauma or the difficult things you're experiencing because of the perimenopause, menopausal symptoms. So if you're having vaginal dryness, if you're having inflammation, if you're having pain, you don't want to have sex because it hurts you. So therefore you lose that desire to have sex. So it's important that you address those symptoms, that you're talking to a doctor about them, that you're getting treatment for it, that you're doing something, or you're using products that are going to make that better, which then again affects your desire. So those are kind of my three things that I always talk about. Open up to the doctor for more.
No, I think you hit on the main ones, honestly. I cannot stress enough that sex and intimacy are two different things. And so the only extension that I will mention about that is relational. many things that have to do with libido or the lack of sexual desire could be strictly relational. And also opening up the conversation that many women can still have a desire, but know that their partner can't. And so that decreases their desire, or they feel that, well, I mean, I just don't have a sex life because of my partner. These are real conversations. And the extent of that can impact a woman a certain way. And it becomes, okay, if you don't use it, you lose it. And all of a sudden she's starting to experience some additional symptoms along with it. So experience from a relational component is definitely there. I work within, a spectrum of integrative and functional medicine, and I work with a health coach, and she's very into understanding even those body traumas, something that Colette has just mentioned, even more so really being more, not only more communicative with your partner, but more communicative and open to yourself and what you're experiencing. So going back to exactly what she said, what do you want? How do you want to feel? What do you want to experience? Because it becomes a collective of not only having vitality during sex, but to feel like you can be intimate with your partner because there's been a sense of vulnerability that's been shared.
Thank you both. I know we're almost out of time, but there's a couple questions or answers for my question that came in. So one of the answers was frequent yeast infections. I am now on an extended dose of fluconazole and they seem to keep coming back. I'm assuming, what can I do? What are the options that I can look for in the toolbox?
So I've become this physician where definitely people will come and see me as a second consult, or like out of the box, what's going on, and have a little bit more time and figure things out. And I'm not gonna say the name of the test necessarily out there, but I don't know if this is the venue to do it for sure, but I've actually been doing some more advanced testing, and that's usually my repertoire anyway. Of a lot of the traditional testing of what's only covered by insurance, there's more functional in-depth testing that you can do. And when I have a few patients I've seen of recent, same thing, either recurrent BV or yeast, and I do this advanced testing that really breaks down at a very kind of micro level of the spectrum of bacteria that exist, from those that are more disruptive and those that are more protective. And so outside of really evaluating a patient from what's going on, from what they're eating, medications, what is their medical background, I'm able to get a better picture of what's going on and how they're being exposed environmentally in that area, but actually know what organisms are causing more of the issue. And then I can get a more strategized plan of probiotics, nutrition, even down to the name of what it is, because there's so many different, we call lactobacillus, and those are more of the protective organisms, but even those have different like second names, and half of those I always have to remember how to pronounce. But that particular test kind of helps guide me a little bit better outside of some other protocol things that I may do with a patient to get them out of that particular recurrent cycle.
Well, we want to know what this test is.
I don't know if it's, well, there are a few out there, but the one I use is Evie. I have used Evie.
Good, thank you.
Okay.
Awesome. Okay, I know there's more questions, but we're out of time, so I want to be mindful of that. Thank you, everyone. Thank you to our wonderful speakers. This was so amazing and informative. I learned a ton. And I didn't get the chance to talk about Amira, but I will send a follow-up email and provide you with the recording and any information. And this is the first of many, so we're going to keep accumulating the questions and making sure that we address them. But thank you so much for coming, and thank you to the speakers. Yeah.
Absolutely,
Thank you very
great
much
to
for
be
having
here.
us.
Thank you so much.